Welcome back to SG Dr. Wellness. My name is Dr. Chen Yiming. The topic I will be talking about today is lower back pain. If you're suffering from lower back pain, you are not alone. Ask any family physician or orthopedic doctor and we will tell you that the lower back pain is one of the most common reasons for a medical consult. Watch till the end to learn more about how to treat and reduce your back pain. And if you're new to our channel, click on the subscribe button now. In this video, I'll share with you the structures that make up the lower back, the risk factors for lower back pain, the common causes of lower back pain, and the treatments to reduce severity of the pain. And lastly, stretches and exercise to relieve your symptoms. Now before I begin this video, a quick shout out to APOL Singapore, APOL. Now this comfortable ergonomical chair that I'm sitting on is sold on their website. Click on the link in my description box to access the selections. You can also click on the link on the top right of your screen now to access the site. Okay, so I'm going to first talk about the structure of the lower back, and I'm going to use my friend here as a model to showcase the lumbar vertebrae. Okay, the lower back is where most of the pain occurs. It supports much of the weight of the upper body, and it is made up of the 5 lumbar vertebrae with the soft rubbery shock absorbers called intervertebral discs in between. Bands of tissues known as ligaments hold the vertebrae in place, and tendons attach muscles to the spinal column. Multiple pairs of nerves that originates from the spinal cord will exit the spinal column in between these vertebrae. Right? So you can imagine the lumbar vertebrae as a pole that supports whatever is on top of it, and this pole itself is being reinforced and supported by the ligaments and tendons and muscles surrounding it. So any issues or problems affecting any of these structures that I've explained can cause back pain, okay, of varying duration and degree. Right? Let me put this guy back. So now, what are the risk factors for lower back pain? Age is a major risk factor. The first attack of lower back pain typically occurs between ages of 30 to 50. With advancing age, we can have loss of muscle elasticity and tone. The intervertebral discs begin to lose the fluid and flexibility as well, reducing the ability to cushion the vertebrae. Loss of bone strength from osteoporosis can lead to increased risk of fractures too. Secondly, poor fitness levels. Back pain is more common amongst those who are not physically active. Weak back and abdominal muscles may not properly support the spine. Weekend warriors are more likely to suffer painful back injuries than people who make moderate physical activity a daily habit. And studies have also shown that low-impact aerobic exercise can help maintain the integrity of the intervertebral discs. 3. Weight gain. Being overweight or quickly gaining significant amounts of weight can put stress on the back and lead to lower back pain. 4. Job-related factors. Having a job that requires heavy lifting, pushing or pulling, particularly when it involves twisting or vibrating of the spine, can lead to injury and back pain. Working at the desk all day long can contribute to pain, especially from poor posture or from sitting in a chair with poor back support and poor ergonomic design. Especially since most of us are working from home nowadays, I'm sure that a lot of you guys watching this video may be suffering from lower back pain. There are also growing evidence that suggests high workload, monotonous work, and job dissatisfaction are linked to lower back pain. 5. Smoking. Smoking can restrict blood flow and oxygen to the discs, and that cause them to degenerate faster. 6. Mental health issues. Anxiety and depression and stress can influence how closely one focuses on their pains as well as their perception of its severity. Stress can cause the body to be affected in numerous ways, including muscle tension, which can then contribute to back pain as well. So there are actually many causes for lower back pain. Broadly, I divide them into congenital cause, degenerative cause, injuries, medical causes. So let's touch on congenital first. Congenital causes refers to causes that may be inborn or arises from a very young age. For example, a lot of youngers may have curved spine, otherwise known as scoliosis. Some children can also have fractures of the vertebrae joint from birth, medically known as spondylolysis. This can result in back pain from a very young age. Degenerative causes. This is the complete opposite of congenital. These conditions occur due to age-related wear and tear and breakdown of joints and support structures of the lower back. Intervertebral disc degeneration occurs, resulting in the rubbery discs eventually drying up, reducing their shock absorption capability. Lumbar spondylosis, which is basically wear and tear and degeneration of the joints and bones of the spine as people get older. Age-related loss of muscle and tendon elasticity. These age-related conditions are amongst the top causes of lower back pain. 3. Injuries, of course. Fractures of the vertebrae, sprains, strains, tears and spasms of back muscles, tendons and ligaments due to sports, falls or accidents are also common reasons for sudden severe back pain. Fourthly, medical reasons. Some medical causes of lower back pain may include inflammatory conditions like spondylitis, rheumatoid arthritis, and so forth. So what are the treatments available for chronic lower back pain? Definitely, the first option include medications. Medications like paracetamol, NSAIDs, opioids, and muscle relaxants can be used from time to time to relieve intense back pain. However, I would caution against reaching out for painkillers the moment you feel pain, as you may become dependent on them. Now, in my practice, I use it mainly to reduce the intense pain so that my patients can be mobile enough to carry out stretching and physiotherapies. Topical pain relief such as medicated creams and gels or patches can also be useful in reducing pain. Secondly, physical therapy. This involves using extremes of temperature or muscle stimulations to modify the perception of pain. Hot or cold packs, when applied to the region of pain, can reduce the intensity. TENS, TENS, or transcutaneous electrical nerve stimulation are battery-powered devices which places electrodes on the skin over the painful area. They send electrical impulses into the muscles, causing muscle twitching. So these are designed to block or modify the perception of pain too. Massages or gentle spinal manipulations can be done by experienced practitioners to provide small to moderate short-term relief of back pain with the approval of your doctor, as definitely. 3. Avoidance of prolonged bed rest, as they can further weaken your core muscles, resuming normal activities as soon as you can. 4. Stretching and exercise. This is probably one of my top options for chronic lower back pain. A vast majority of back pain that I see in my clinic is occupational related or age related. Exercises and stretching can help to reduce muscle spasms and knots. And in addition, by strengthening the core or abdominal muscles, you are increasing the support for the vertebrae as well. This can accelerate recovery from back pain and reduce and prevent future occurrences. At the end of this video, Alvin, our certified fitness trainer from fitivate.com, will demonstrate some stretching exercises that can reduce lower back pain. These are easy movements that you can do at home with little or no equipment. Alright, over to you now, Alvin.
Hi everyone, this is Coach Alvin, and I'll be sharing some simple back stretch exercises with you today. These exercises are meant to help relieve back tension, but however, if you were to feel any discomfort or acute pain when carrying out these exercises, please stop immediately and seek medical attention. Now let's go! So for the first exercise is what we call the knee to chest stretch. First, lie down flat on the floor and bring one leg up using two hands to press down towards your body as much as possible. Hold this position for about 30 seconds to 1 minute before switching over to the other leg. You can repeat about 3 to 5 sets for this stretch. Next will be the seated spinal twist. Sit on the floor as such, cross your right leg over your left like so, and use your right hand to anchor your upper body in this position. Twist your entire upper body to the left whilst using your right hand to give it a further nudge. Feel the stretch on your lower body and hold this position for about 30 seconds to 1 minute before switching over to the other side. You can repeat this exercise for about 3 to 5 sets. The next exercise is what we call the lower back rotational stretch. Lie down flat on the floor as such. Sprawl your hands out for stability and raise your legs up as such, keeping your knees bent at about 90 degrees, knees together and feet together. Right, and rotate to the left or to the right, whilst still looking up at the ceiling. You can do about 10 repetitions for this exercise, about 3 to 5 sets. So the next exercise that we're going to carry out is known as the Sphinx pose. First, lie down on your tummy as such. Keep your legs together. Bring your body up, upper body up, by keeping your arms at about 90 degrees around the elbow and look forward. You should feel a stretch on your lower back. Hold this position for about 30 seconds to 1 minute. However, if you don't feel as much as an intense stretch as you would like, you can actually carry out another pose known as the Cobra pose. Bring up your upper body by straightening up your arms as such. You can either look forward or look up. You should feel a more intense stretch on your lower back by carrying out this pose as compared to the Sphinx pose. Similarly, hold this position for about 30 seconds to 1 minute. You can actually repeat this exercise for about 3 to 5 sets.
Great! I hope you have learned a lot more about back pain, some of the risk factors and causes for it. More importantly, learn about stretches and exercises you can perform at home to reduce your back pain and strengthen your back and core muscles. And if you are working from home and if you happen to be shopping for a good chair, click on the link in the description box below that will bring you to the APOL website. So subscribe, like and share this video. In the video next week, I'll be zooming in on the ergonomics of working from home to prevent back and neck pain. So stay tuned for it. Until the next time, stay safe, stay healthy.